The cooperative roots of the NHS. The National Health Service is often described as a uniquely British achievement. It was launched in 1948 to provide universal health care, free at the point of use. But the NHS didn't appear out of nowhere. Its foundations were laid in South Wales, where coal miners and their families had already created cooperative health systems decades earlier. In the 19th and early 20th centuries, miners in South Wales worked some of the toughest and most dangerous jobs in Britain. The pits were brutal, injuries were common, lung disease was rife, and life expectancy was short. Medical care existed, but it was patchy and expensive. Families often had to choose between going without treatment or falling into debt. Before the societies, many relied on patent medications, folk remedies, or charity doctors. A single doctor's fee could equal a day's wages, so illness often meant either debt or untreated suffering. The miners responded in a way that was typical of South Wales at the time. They organised. Across the coal field, workers created medical aid societies, cooperative associations where each member contributed a small weekly payment from their wages. In Tredegar, it was as little as 3p per week, deducted straight from wages. That tiny contribution covered not only the worker, but his wife and children too, unheard of in Britain at the time. Together, their contributions funded doctors, nurses, hospitals, and medicines for members and their families. These were not charities. They were democratically governed organisations run by committees elected from the pits. Decisions about which services to provide, which doctors to hire, and how much to charge in contributions were made collectively. Each miner had a stake in the system, and the system existed to serve them. The most famous of these was the Tredegar Workmen's Medical Aid Society. Founded in the late 1800s, the society grew to cover around 95% of Tredegar's population by the 1920s. Almost everyone in the town, miners, steelworkers, and their families, paid in and received care. The Tredegar Society went further than most. It directly employed doctors, ran its own hospital, and even offered dentistry and spectacles. Members received comprehensive care, free at the point of use. It wasn't just medical treatment. Eye care, dental care, maternity services, and medicines were all included. The whole family was looked after, not just the wage earner. For decades, Tredegar's system provided what looked remarkably like a miniature NHS, sustained entirely by the pooled contributions of working people. These medical aid societies worked because ordinary miners stepped into the role of stewards. They weren't medical experts, but they were elected representatives of their communities. They sat on committees, negotiated contracts with doctors, managed funds, and ensured services remained affordable. Doctors accepted lower pay than in wealthier districts, but in return, they gained security, steady salaries, and deep respect within the community. And crucially, they answered to members, not to private profit. The connection between Tredegar and the NHS is by no means a coincidence. Aneurin Bevan, who would later become Minister of Health in Clement Attlee's post-war Labour government, grew up in Tredegar. As the son of a miner, Bevan saw firsthand how the Medical Aid Society transformed his community's health. As a young man, he served on the Society's management committee, giving him direct experience of how cooperative healthcare could work at scale. When he was given the responsibility of creating a national health service after the Second World War, Bevan didn't have to start from scratch. He already had a working model in his mind: Tredegar. He later said, All I am doing is extending the entire population of Britain the benefits we had in Tredegar for a generation or more. In 1948, the NHS was launched. Instead of being funded by pit-level contributions, it was funded through national taxation. Instead of being governed by miners' committees, it became a public service managed through government structures. But its DNA, free care at the point of use, funded collectively, accountable to the people it served, came directly from the cooperative traditions of South Wales. When people say the NHS is failing, it's worth remembering where it came from. It was not designed as a business model, but as an extension of cooperative healthcare rooted in working class communities pooling resources to protect one another. The story of Tredegar shows what's possible when people take control of essential services together. Even without owning the coal mines, miners proved they could co-own their health system, and that system became the foundation of one of the most important public institutions in the world. The key lesson here is that the NHS wasn't gifted from above, it was built from below, on the sacrifices and solidarity of ordinary workers who believed that no one in their town should face sickness alone.